Epilepsy is very common in the general population. 1 in 100 people have epilepsy. The EMU stands for Epilepsy Monitoring Unit. It's an advanced area of testing in the hospital where we look for neurologic conditions. We have specialized equipment that records brain waves and does some other testing that can help us diagnose and help us figure out how to treat neurologic disorders.
So when a patient comes to us in the EMU, they've come from the neurology clinic to help categorize their seizure. And what happens is they will come for a 3 to 5 day stay, and we try to provoke seizures so that we're able to help classify what type of seizures they are and able to go down the avenue of either correct medication, or if it's not an electrical seizure, then a different avenue to be able to help them.
The neurodiagnostics technologists get the electroencephalogram placed and begin monitoring. Unlike an MRI or a CAT scan that takes a picture of the anatomy in a person's brain, the electroencephalogram looks at the function of the brain and does so over time. And so the brain waves are different whether you're awake or you're asleep or you're having a seizure. And so we'll watch the brain waves continuously over a period of time until we get the information that we need to know what to do with the patient. The reason that we have them do this in the unit is that we take a lot of safety precautions to make sure that although we're inciting seizures to happen, that the patient's safe while they're there.
One of the things we modeled for safety in our EMU came from the Mayo Clinic. We have what's called LICO lifts. They are tracks in the ceiling. A patient is harnessed into a master vest and they walk within that track in the epilepsy monitoring room. They're not confined just to the bed. And with that vest on, if they have a seizure when they fall, then they're just suspended and the nurse can pull them right back to bed. We
have patients come into our office that basically are having episodes of usually loss of consciousness or convulsions or other problems, neurologic problems. Sometimes we discover that those are due to other things that are not seizures, in which case we get patients on the appropriate track to get taken care of. We had a patient come in with what were thought to be seizures, and it turns out it was probably a heart rhythm problem, and he had a pacemaker placed about a week later. So while that wasn't seizures and I turned that patient over to the cardiologist, it probably saved his life. Our neurodiagnostics lab is accredited by ABRET, which is the American Board of Registration of Electroneurodiagnostic Technologists. It's our national governance board. We are the only ABRET accredited lab in Idaho, and the next closest one is in Seattle. I've worked in a couple of other locations that have epilepsy monitoring units, and what we have available here in North Idaho rivals anything you could do or have performed in a big academic center in a big city. And we're really blessed to have that available here.